Sometimes it can signal a more serious underlying health issue. So, let's dive right in and cover the signs and symptoms of diarrhea. First up, the primary symptom: frequent, loose, and watery stools. This one's pretty straightforward. If you're spending more time in the bathroom than usual, it's a sign. Next, abdominal cramps or pain. These might occur before, during, or after bowel movements. Not fun, I know. Bloating is another symptom. You might feel full or bloated even after eating a small amount. Nausea and vomiting often accompany diarrhea, especially if it's caused by a virus or bacterial infection. It's like nature's way of saying, take it easy. A fever can also be present if the diarrhea is due to an infection. This is your body's way of fighting off whatever's causing the issue. Urgency is another telltale sign. The need to have a bowel movement might come on suddenly and urgently. Don't ignore this. Incontinence or having difficulty controlling your bowel movements can sometimes occur. It's not something to be embarrassed about. It happens. Now, if you notice blood or mucus in the stool, that's a red flag. This can be a sign of a more serious condition, like inflammatory bowel disease or an infection. Definitely worth discussing with a doctor. So when should you seek medical attention? If your diarrhea lasts more than a few days, if you have severe abdominal pain or cramping, if you see bloody or tarry stools, these are all reasons to consult a healthcare provider. Also, signs of dehydration like extreme thirst, dizziness or lightheadedness, fever that doesn't go away, or difficulty maintaining weight due to diarrhea are clear indicators that you need medical advice. Remember, it's always better to be safe than sorry. If in doubt, talk to a healthcare professional.
Discuss diarrhea. It's more common than you might think, and understanding the causes and risks can help you manage it better. First off, what exactly causes diarrhea? Well, diarrhea is usually a symptom of an underlying issue rather than a condition itself. One of the most common causes is a viral infection, often referred to as the stomach flu. Bacterial infections from contaminated food or water can also lead to those dreaded trips to the bathroom. Traveler's diarrhea, anyone? Another major cause is food intolerances or allergies. Lactose intolerance, for example, can cause digestive issues when dairy products are consumed. Similarly, some people have trouble digesting gluten, leading to conditions like celiac disease. Medications are another common culprit. Antibiotics, for instance, can disrupt the natural balance of bacteria in your gut, leading to diarrhea. And let's not forget stress and anxiety. They can also wreak havoc on your digestive system. Now, you might be wondering, who is at risk for diarrhea? Well, the short answer is everyone. But certain groups are more susceptible than others. Infants and young children are particularly vulnerable because their immune systems aren't fully developed. Older adults also have a higher risk, partly due to weaker immune systems and underlying health conditions. Travelers to foreign countries, especially developing nations, often encounter unfamiliar bacteria or parasites in food and water, making them prime candidates for travelers' diarrhea. People with chronic conditions like Crohn's disease or irritable bowel syndrome, IBS, are also at a higher risk. So, what can you do to mitigate these risks? First and foremost, maintain good hygiene. Wash your hands regularly and be cautious with the food and water you consume, especially when traveling. If you have a food intolerance or allergy, avoiding trigger foods is crucial. In summary, while diarrhea is uncomfortable and inconvenient, understanding its causes and who is at risk can help you take preventive measures. Always remember, if symptoms persist, consult a healthcare professional.
Nonetheless, how to prevent and manage diarrhea effectively. Let's break it down into simple, actionable steps you can follow to keep yourself and your loved ones healthy. First up, sanitation. Maintaining a clean living environment is crucial. Make sure to regularly clean surfaces, especially in your kitchen and bathroom. Use disinfectants and keep your surroundings tidy. This simple practice can significantly reduce the risk of infections that cause diarrhea. Next, hand washing. It sounds basic, but it's incredibly effective. Wash your hands thoroughly with soap and water for at least 20 seconds, especially before eating and after using the restroom. If soap and water aren't available, use an alcohol-based hand sanitizer. Now, let's talk about water. Always drink clean and safe water. If you're unsure about the water quality, consider boiling it or using water purification tablets. Investing in a good water filter can also be a game changer for your health. Vaccination is another key player in preventing diarrhea, especially if you're traveling to places where the risk is higher. Vaccines for rotavirus and cholera can offer protection against these diarrhea-causing infections. Make sure to stay up to date with your vaccinations. Nutrition is vital too. A balanced diet rich in fruits, vegetables, and whole grains can strengthen your immune system. Foods high in fiber can help maintain a healthy digestive system, reducing the risk of diarrhea. Probiotics deserve a special mention. These beneficial bacteria can improve gut health and boost your immune system. You can find probiotics in yogurt, kefir, and supplements. Including them in your diet can help in both the prevention and management of diarrhea. Alright, let's move on to managing diarrhea if it does occur. First and foremost, stay hydrated. Drink plenty of fluids like oral rehydration solutions, clear broths, and water. Avoid sugary drinks and caffeine, as they can make dehydration worse. Eating the right foods is also essential. Stick to bland, easy-to-digest foods like bananas, rice, applesauce, and toast. The brat diet. Avoid dairy, fatty, and spicy foods until you recover. And what about medications? Over-the-counter options like loperamide can help reduce the frequency of diarrhea. However, consult a healthcare professional before taking any medication, especially if you have underlying health conditions or are on other medications. Remember, diarrhea is usually a short-term issue, but if it persists for more than a couple of days, seek medical advice. Chronic diarrhea can indicate a more serious underlying condition that needs professional attention. So, there you have it. Simple and effective ways to prevent and manage diarrhea. Stay clean, eat well, and keep those hands washed.
Diarrhea, a common digestive issue, usually resolves on its own. However, understanding when further investigation is needed is crucial. This involves recognizing warning signs and understanding potential complications. Proper diagnosis helps determine the best course of treatment and ensures optimal patient care. Diarrhea can range from a mild, temporary inconvenience to a sign of a more serious underlying condition. By carefully evaluating symptoms and medical history, healthcare professionals can determine the appropriate level of intervention. Timely and accurate diagnosis not only addresses the immediate discomfort, but also helps prevent potential long-term health consequences. This is particularly important in vulnerable populations, such as infants and young children. Through a collaborative approach between healthcare providers and patients, we can effectively manage diarrhea and promote overall well-being. While most cases of diarrhea are self-limiting, certain situations warrant further investigation. Infants, especially those younger than 6 months, are particularly vulnerable to dehydration from diarrhea. Prolonged diarrhea, lasting more than a few days, also necessitates medical attention. The presence of blood in the stool, severe abdominal pain, or persistent vomiting raises concern. Travelers' diarrhea, especially from developing countries, often requires specific treatment. Diarrhea outbreaks in settings like daycare centers or nursing homes necessitate prompt action to prevent widespread infection. Individuals handling food, such as restaurant workers, should seek medical advice if experiencing diarrhea to prevent potential outbreaks. Early recognition of these red flags allows for timely intervention and reduces the risk of complications. Evaluating the severity of diarrhea in children involves considering various factors. Frequent watery stools, especially if accompanied by vomiting, indicate a higher severity. Signs of dehydration, such as decreased urination, dry mouth, and lethargy, are alarming and require immediate medical care. Healthcare providers use specific criteria, including the frequency of diarrhea, presence of blood or mucus in the stool, and signs of dehydration, to assess severity. This assessment guides treatment decisions and helps ensure the child receives appropriate care. Section 4. Investigating chronic diarrhea, unraveling the underlying cause. Diarrhea persisting beyond 4 weeks is classified as chronic and requires a comprehensive evaluation. This often involves a thorough medical history review, physical examination, and laboratory tests. Blood tests, such as a complete blood count, can detect signs of infection or inflammation. Thyroid function tests help rule out hyperthyroidism as a contributing factor. Celiac disease testing assesses for gluten intolerance, a common cause of chronic diarrhea. Stool studies can identify infectious agents or inflammatory markers. Section 5. Specific tests. Targeting the root of the problem. Depending on the suspected cause, additional tests may be necessary. Colonoscopy, a procedure using a flexible camera to visualize the colon, helps rule out conditions like inflammatory bowel disease or colon cancer. A hydrogen breath test can diagnose lactose intolerance, a common digestive disorder. Imaging studies, such as an abdominal ultrasound or CT scan, may be ordered to evaluate the digestive tract for abnormalities. Biopsies, small tissue samples taken during endoscopy, help identify microscopic inflammation or other abnormalities. Section 6. Guidelines and precautions. Protecting vulnerable individuals. Guidelines from reputable organizations, such as the American Gastroenterological Association, provide evidence-based recommendations for managing diarrhea. These guidelines emphasize the importance of early recognition and treatment, especially in high-risk individuals. Preventing dehydration through adequate fluid intake is crucial for everyone, especially infants, young children, and older adults. Maintaining good hygiene practices, such as frequent hand washing, is essential in preventing the spread of infectious diarrhea.
Diarrhea is a serious health problem around the world. In 2004, it affected billions of people. This illness causes frequent, watery stools and can lead to dangerous dehydration. Diarrhea is a major concern for global health, especially for young children. Diarrhea is often caused by germs in contaminated food and water. These germs spread easily in places without good sanitation. This makes diarrhea a bigger problem in developing countries. Children under 5 are most vulnerable to diarrhea. Their bodies are still developing, making them more likely to become severely dehydrated. In 2004, diarrhea caused a staggering number of deaths in this age group. More than 1.5 million children under 5 died from diarrhea in 2004. This means that thousands of young lives were lost every single day due to this preventable disease. The impact on families and communities is immeasurable. The burden of diarrhea is not evenly distributed. More than half of the deaths from diarrhea in children under 5 occurred in just 2 regions, Africa and South Asia. These regions often lack access to clean water, sanitation, and adequate healthcare. This highlights the link between poverty and diarrhea. Limited access to basic resources increases the risk of exposure to the germs that cause this deadly disease. Section 4. Hope on the horizon. Progress in reducing deaths. While the numbers are still concerning, there has been progress. In 1980, diarrhea caused the deaths of 4.5 million children. By 2004, that number had significantly decreased. This progress is due in part to increased awareness, improved sanitation, and access to oral rehydration therapy. However, much work remains to be done to eliminate this preventable disease. Section 5. The fight continues. Protecting children from a preventable threat. Diarrhea remains a leading cause of death for children under 5, second only to pneumonia. This is unacceptable, as simple interventions can prevent and treat this illness. Access to clean water, sanitation, hygiene education, and vaccination are crucial. By investing in these areas, we can protect children and save lives. The fight against diarrhea is a fight for a healthier and more just world for all.
If you found this video helpful, Don't forget to like, share, and subscribe for more health tips. Thanks for watching and take care.